Classification of fracture. Fractures can be classified on the basis of etiology, on the basis of displacements, on the basis of relationship with external environment, and based on the patterns of fracture. First, on the basis of etiology. There are three types of fractures based on the etiology, that is traumatic fracture, pathological fracture, and stress fracture. Traumatic fracture due to trauma. Then pathological fracture, fracture occurring in a weak bone. For example, like osteoporosis. Then stress fracture due to chronic repetitive injury. The next, on the basis of displacements, there are undisplaced fracture and displaced fracture. Then third, on the basis of relationship with external environment, that is closed fracture or open fracture. Closed fracture means not communicating with external environment and the skin and soft tissue will be intact. Open fracture means break in overlying skin and soft tissues will be there. And the open fracture, it is again divided into internally open, that is from within, or externally open, that is open from outside. Then there are simple fracture and complex fracture. Simple fracture means there will be only two pieces. Complex fractures, multiple pieces will be there, like comminuted fractures. Then based on high velocity, that is whether high velocity fracture or low velocity fracture. That is, in high velocity fracture, it is there will be severe fractures, for example in case of RT and all. Then low velocity fracture with a mild trauma. Then the classification, there are depending on the pattern, there are transverse fracture, then oblique fracture, then spiral fracture, then comminuted fracture, that is with the multiple segments, then segmental fractures, that is fracture at different levels.